therapist here in town, and my specialty is eating disorders, so I don't want to scare you too much, but so the talk today is really geared more towards just keeping exercise healthy, and I just want to give you guys some things to think about in regards to that. But there's a couple of agendas that I kind of need to make clear from up front. One is, obviously, I want you to enjoy exercising. I mean, we are in a health club, fitness club, so I'm certainly not anti-exercise by any stretch of the imagination. But my second agenda, which really is just as important to me, I've been working with people with eating disorders for almost, I hate to tell you, but like 30 years. And being in the trenches and hearing stories and knowing, how difficult that struggle is, I need to be clear that if you're female and or you go to a gym, absolutely 100% you have encountered somebody with an eating disorder, right? And my message to you is that the way that you talk about your body and your food and your exercise and your weight absolutely matters, okay? So even if you're hearing the material today and you're like, this is not a problem for me, I'm totally healthy in this regard, my other agenda is I really want us to be cognizant of the fact that there is a very precarious zone that people get into where they can flip right off a cliff with an eating disorder. And once that happens, it's a lot of work. And it is not fun, and it is painful. And I really feel like, if we really are going to make a significant impact, in decreasing both the incidence and the severity of eating disorders, we have to all be a part of that solution, right? And so how we talk about how we just function, as people, how we talk about health, how we talk about our bodies, how we talk about fitness, really does matter, because folks that are in that precarious zone are sponges for information that is not accurate, right? And you may be talking about things in a really benign kind of way, and it's not an issue for you, but for them, it might be really intense, and it might actually be something that fuels a very distorted perspective. So I want to be clear that it's not just about you guys. I really want to call you and invite you into being a part of a solution for a really significant problem in our world. So, having said that, I'm not going to spend a ton of time on research, but some things that I think are just really important for us to know is that these things do get studied, and I need to change my slides because some of these are a bit old, but the research is incredibly consistent that exercising with the intention and the focus on appearance really never leads anywhere good, right? In fact, there isn't one up here, but there's quite a bit of research that also indicates folks that exercise just for appearance reasons, losing weight, looking better, looking more fit, actually don't consistently exercise, and they don't do it long term, right? And it actually has the side effect of creating more of a negative body image instead of a positive body image, which is really silly because we would want any kind of physical activity to generate a sense of positive body image, right? So it does matter, that, what I would say is all the research is skewed towards how and why we exercise matters, right? It's not just, if it's a healthy protocol, if it's a healthy routine, if I'm keeping it in a healthy context, it's fine. No, it really does matter. We all know that exercise helps with stress management. It can help with, just as a part of a weekly, strategy to keep yourself sane. It can be really helpful with that. But if it's your only way of coping, you want to be careful. There's an unbalance there, right? Because we all need to cope. We all have stressful things going on in our lives. We're all going to need some way of letting emotions out. And if the only way that you do that is through exercise, there's an imbalance there. Obviously, if you're exercising even when you're injured, that is problematic and it's unbalanced, because part of being healthy, obviously, is taking care of your body. And so if you're ignoring your body to keep exercising, there's going to be an imbalance. And then also, something that we don't often think about is withdrawal effects. If you find yourself or anybody who's super irritable or super crabby because they didn't get their workout in, or their sleep gets disrupted or whatever, there's an imbalance. There's too much dependency on the actual activity to be able to keep your well-being up. Other things, obviously, if you're having overuse injuries, stress fractures, these are physical, these are physical symptoms, signs that things are not in balance. Either you're not getting enough nutrition, you're not getting enough rest, the actual type of activity that you're doing is not balanced and it's causing too much stress. Obviously, menstrual irregularity. I don't know that I need to say this, but I will. The whole notion that athletes, it's okay if they don't get periods, like nobody believes that anymore, okay? There used to be kind of a sense that, cross-country runners and really elite athletes, and if you have really low body fat, it's okay that you don't have a period. It's really not okay. And in fact, the standards across the board have changed. It is now no longer okay, even in the NCAA, to keep doing sport if you're not having a period. I have worked with many Notre Dame athletes who were put on injured reserve simply because they weren't having periods. And so that is no longer an okay thing. And obviously, the reason for that is because there's typically loss of bone density when that's happening. Decreased immunity, cold, upper respiratory tract infections. Those are just physical signs and symptoms that maybe something's out of balance. So even if it looks like your exercise routine is maybe okay, it feels moderate to you, if you're having signs and symptoms physically, your body is telling you something. And what it's telling you is that no, things are out of whack. Also, I feel like the inflexibility of exercise, right? If you can't change your schedule, if you can't be flexible because of your exercise routines, that's clearly out of balance, right? Like, exercise needs to promote a healthy life. We don't want to create a life that's just about exercise. Obviously, as sport performance goes down or there's overtraining syndrome, these kinds of things are indicators that something is awry. So if you want to assess whether or not your exercise is healthy and it's staying in balance, here's a couple of things we want to look at. First one is motivation for exercise. This is what I was saying earlier. The how and the why matters, right? Exercising primarily for appearance or for body looks is just starting to edge you towards that very precarious zone. So we want to think about, like, why do I want to exercise? What's the motivation behind it? We'll talk about some positive motivations, down the road. Intensity of exercise or the emotion associated with it. I can't tell you how many times I'm in my office talking with folks about their exercise, and maybe they've been injured, maybe something's happened where they've gotten a message, either from their physician or someone that they have to curtail it a little bit, and they are way too emotional about this. There's a lot of intensity around it. Or people that just feel like, oh, it's so important, like it is the highest priority of my week or of my day. Some of that intensity probably is indicating that maybe some things are imbalanced. Again, it's a good thing, we want to have it, you want to create some kind of a structure so that it's happening regularly, but if you're feeling really keyed up about it, we want to assess that, we want to be mindful about what that means. Again, the flexibility of routine or schedule, injury, just not only how often there might be injury, but also your response to it, right? If you're finding that, like, being injured just is overridingly sad, depressing, I'm not coping very well with it, as opposed to looking at it as, it happens, I have to respond, it's temporary, I'm responding in a way that I'm actually getting what I need, all of that really helps us assess whether or not there's an over-exercise or unhealthy balance. And then your satisfaction with size, body shape, or fitness level. As we were saying earlier with some of the research, the whys matter, right? The why that people are exercising or the motivation for that does matter. And if it's highly focused on appearance, there's a high probability that you're going to actually have less body satisfaction, less, pleasure with exercise, and just not liking your fitness level. If you're just constantly dissatisfied, we have to assess that, right? We want to create some kind of routine with exercise that promotes overall wellness, right? And that's going to include size, body shape, fitness level, kind of recognizing, okay, this is where I'm at, and I have some fitness goals, or I have a pathway that I'm going on. but really holding yourself accountable to feeling positive about wherever you're at, right? I'm starting, I'm on this space, maybe I'm moving in a particular direction, but really not using self-criticism or negative body image to try to motivate that journey. But rather saying, you know what it is, I'm here, I'm moving in a good direction, but I really want every step of the way to feel good and positive and healthy for me. So we know that exercise is a problem when it starts to interrupt or interfere with the maintenance of good physical health. So obviously, if it starts affecting eating patterns, if it starts affecting sleep patterns, if you're having multiple injuries, but also the maintenance of good psychological health, right? If you find yourself too keyed up, or like I said earlier, if you're too dependent on exercise to be your coping strategy or keep things, on an even keel, we might want to start assessing that and kind of paying attention that maybe I'm putting too much emphasis on it. The other thing is just the maintenance of good relationships, right? Nobody wants to be that person who is talking about exercise 24/7 and your friends start, kind of veering away. We had a good friend that my husband and I used to go out to dinner quite often with her and her husband. And honestly, she had never really cared much about health, never really looked at doing anything physical. And she sort of had this awakening because she started to have some struggles with that. She started walking more, she was even running a bit. Some of her dietary patterns changed, and we were all very supportive and positive. And then one night, we went out for dinner with her, and she read the menu to us. Literally, long after we had ordered our food, she read, oh, that's interesting, that one's low in cholesterol, and that one only has that many calories, and that one has this. And my husband and I were just standing there like, okay, this is no longer fun. This is no longer interesting. And we got in the car and my husband said to me, that's it. We are done going out for dinner until she gets beyond this thing. Because I am not going to spend good money on a dinner and spend my Friday night talking about the content of fettuccine Alfredo. And I got to tell you, I see this all the time in my office that if exercise starts becoming a problem, the people in their lives are noticing it, right? Like it starts to become an issue. People that are struggling with an exercise imbalance have less satisfying social relationships because they're opting out of social relationships to go work out, right? And if there is that, where it starts becoming the only topic, the only thing that you talk about, those relationships are going to be compromised. And if it starts interfering in the practice of everyday activities, right? Like if I'm, getting to work late because I got to get my workout in, or if I'm, my sport, I'm not even practicing my sport because I don't feel like, I have several folks that play softball, and softball players are notorious for, not doing a ton of cardio. So I've had softball players that, will quit softball because they're not getting a good enough workout, right? Things like that. Or they'll be complaining like, I've got to find time to get to the gym even though they're going to softball practice, for 2 hours a day, because it's not really prompting what they think they're supposed to be doing in terms of exercise. So when those normal life behaviors start being impeded because of exercise, we really want to assess that. We really want to kind of draw a line and say, yeah, I think I'm veering over to the unhealthy side. And I just need to say, there is a line at which treatment is needed. And when I say treatment, I'm not saying, oh, you need to be in an eating disorders clinic or something like that. But maybe it's a call that I need some help navigating this. I'm becoming a little too hooked in. I'm becoming a little bit imbalanced, and I need some help setting that right again, right? So if the person cannot not exercise, right, there's a perfectly legitimate reason to take a day off, right? Maybe there's another priority, there's an event, maybe you're tired, but for whatever reason, if you find that I just cannot not exercise, I'm going to push myself, I'm going to make myself do it, you might need some help. Obviously, if a person exercises, in spite of injury or medical advice not to exercise, there's no other way to get around that, right? If someone's telling you it is not in your best interest to exercise and you're doing it anyway, you might need some help to set that straight again. And also if the relationship between eating and exercise is an unhealthy one. And we'll talk about this in a minute, but obviously you have to have a healthy body to exercise. And you can't have a healthy body if you're not eating enough and fueling enough to exercise. So if there's an imbalance there, if the intake is less than what's needed to perform well in terms of exercise, you're going to need some treatment. You're going to need some outside source, because our internal instincts, when you start getting to that precarious zone where things might be really out of balance, our internal instincts don't help us, right? There's a little bit of a frenzy, there's a little bit of a compulsion to kind of keep on going, and sometimes it's hard to see that objectively, and needing treatment or needing somebody else to kind of sit down with you and help you reorganize what that might look like and how to veer yourself back into the healthy side. So when exercise is an eating disorder symptom, is when it's used to compensate for eating. Now, and I want to be clear that just because it's a symptom of an eating disorder doesn't necessarily mean, lots of people might engage in problematic behavior and not have an eating disorder, right? But when there's a direct link between how I'm eating and how I'm exercising, and if it compensates for that, and the same thing with legitimizing eating. So if you find yourself, worrying about, oh, I ate something that I probably shouldn't have, or it was too many calories, and now I have to go exercise. If there's a link there, that can be problematic. Same with legitimizing eating, right? Like, oh, I'm going out for dinner tonight, and I'm going to eat whatever I want and however I want, so I really got to work out right now to be able to compensate for that or to prepare for that. Or if eating is used to reward exercise, right? Like, oh my gosh, I had an amazing workout today, so I'm going to let myself eat something that I really, maybe I don't normally eat, or maybe eating inappropriately, right? But I'm rewarding myself because I worked out so much. And obviously, if eating and exercising creates a negative energy balance, meaning I have less coming in than I'm expending, then we're having a negative energy balance, and that is a sign and a symptom of an eating disorder. And then lastly, if a person uses dissatisfaction with size, shape, weight, or fitness level to rationalize excessive exercise, even when their size, shape, weight, and fitness level really is within a healthy range. So when folks are, constantly feeling dissatisfied, constantly complaining about what their size is, and they're a normal size, but they're using that to rationalize excessive exercise. I have to go to the gym. You don't understand. If I don't go to the gym, I'm going to fall apart, or my body isn't going to be where it needs to be, and just carrying a really distorted image. When a distorted image fuels over-exercise, then we're talking about an eating disorder and not just an unhealthy balance. So how do we keep it healthy? Because obviously there's that zone, like I said earlier, nobody wants to develop a problem with these issues. Nobody wants to develop an eating disorder, but there is that precarious zone that sometimes it's insidious, it's subtle, people can fall into that zone and then they're off the cliff, not that much longer. So how do we keep it healthy? And this is more what I think appeals to folks that are coming here. Be mindful of your attitudes and beliefs about exercise, right? Check those, it's all over the place. And without even realizing it, we start absorbing some of those really unhealthy attitudes. So check those at the door. Seek out accurate information, right? Don't just assume that what seems right or what you see somebody else doing is healthy. Check it out, ask your physician, talk to your personal trainer. Look for what really is healthy exercise and what is excessive or overtraining. Emphasize that healthy exercise, this is what I was saying earlier, it needs a healthy body, so there has to be healthy nutrition. Setting up the mindset that exercise is for health, right? It's for enjoyment. It helps you get better at your sport, but it's not for the purpose of losing weight. Now, obviously, people that exercise consistently are going to lose weight if they have weight to lose. But studies really indicate that if you are exercising exclusively to lose weight, you're probably not going to consistently exercise long enough to maintain a healthy weight. And often what happens is we get this yo-yo dieting, yo-yo weight experience where folks are going to the gym, they're dieting, they're losing weight, but then something happens, they kind of fall off the wagon, they gain all the way back, start again, on and on. And actually, really, we know that that's actually more unhealthy. That kind of weight fluctuation is more unhealthy than just being a consistent, active person, right? Who's maybe not even exercising or not trying to lose weight, but just trying to get good heart health going on. So we do want to be careful also about just the source of managing emotion, right? We don't want exercise to be compulsive or obligatory. We want it to be something that you're enjoying, that you enjoy doing, that you want to do, because it feels positive, it feels good, and it's a part of a much larger lifestyle of being healthy. Like I said earlier, we have to change the relationship between eating and exercise. Really challenge yourself not to link the two, right? There's such a seduction of that. I hear this all the time, not just in my office, but just from my female friends, where we legitimize eating because we exercise. We rescue ourselves. Oh, well, it's fine, I exercised today, or I'm going to exercise later, or just even feeling compelled to go exercise because I've eaten something. Undoing the effects of eating, we really want to be careful about that link. It's not really, there really isn't a lot of evidence that it works, that we burn off calories that we just ate. If we want to think about it more in terms of, I'm eating in a healthy way that feels positive to me, and I'm exercising in a healthy way that feels positive and enjoyable and is promoting a goodness in who I am. But they're really two separate entities, right? One doesn't necessarily have to affect what I do with the other one. So if you think about it as setting up a routine for yourself where this is sort of what I do with exercise in a weekly basis, right? This is how I fit it into my schedule, here's what I think I need, and I have an eating pattern, right? I have a structure for the way that I feed myself, I have a structure for the way that I eat during the week. But if my eating changes for some reason, maybe I go out to dinner, maybe I eat a dessert, maybe it's someone's birthday, so I eat some things that normally aren't in my plan, I don't need to change my exercise plan as a result of that, right? My exercise plan just kind of keeps on keeping on. And vice versa, right? Like if I have an exercise plan and maybe I have a really crazy busy week, so I don't get to exercise as much as I normally would. Maybe I'm doing something different that week, exercise-wise, and I don't let that change my eating. Well, because I'm not exercising as much, I gotta pull those calories back in. Because maybe I didn't get that workout in yesterday, I've gotta be really restrictive today. That kind of connection, compensation, linking those two things is really problematic, and it really creates an imbalance in terms of healthy, functional exercise. I do think we have to redefine health, right? I hear people use health to justify a lot of really unhealthy things, I knew a guy, who was a good friend of ours for a long time, he moved out of town now, but he used to get up, really, really early in the morning to go work out. And that, sort of fit into a structure, but there would be things that would come up where he'd have something going on in the evening, because he was getting up so early to work out. He was in bed sometimes by like 8 o'clock at night. And he had a young son at the time who he would sometimes never see because his son would go from school to practice and then come home and his dad would be in bed already, And I had to start saying, like, I'm not sure that's healthy, right? I'm not sure that that's creating a dynamic of, you getting, first things first, right? You setting really healthy priorities and feeling good about that. Because you can imagine then how that works. Then he's trying to squeeze in all this time with his son, on the weekends and all of that. And his son was kind of reacting like, I'm busy, I'm doing other things. And it created this very strange dynamic in their relationship. And it had a lot to do with the fact that, he felt like, well, I'm eating healthy, I'm making sure that I make time for it. but the kind of job that he had, you know, he was working a lot of hours, and so for him to be able to get exercise in, you know, he was getting up at like, you know, 3 o'clock in the morning and running sometimes at night or at 3 o'clock in the morning when it's dark out, you know. And you have to start kind of questioning, like, okay, maybe on one level you can justify that this is healthy, but we really have to be careful not to rationalize health, okay? And sometimes we have to redefine it, right? Sometimes you have to take a look at what's happening and say, wait a minute, maybe I started out doing this because I felt like it was going to be good for me, but it's starting to come into a zone that's really not healthy. And we have to feel free to redefine health, right? We have to make sure that for me personally, in my scope, in my context, what does health look like, okay? There's tons, I don't know if you've ever heard the term orthorexia. It's an eating disorder where folks actually are obsessed and very, very rigid with healthy eating, right? Clean eating or being careful about avoiding certain foods. Yeah, you know, we can find all kinds of research that there are certain ways of eating, there are certain diet patterns that are really good, there are certain foods we want to make sure we're eating, other foods we want to eat much more sparingly. But this type of disorder really came out of defining health as being very rigid and very narrow, and as you can imagine, it isn't healthy at all, right? So we do have to kind of look at how is it affecting my life, and how do I define health in a way that works for what I'm dealing with, okay? We do want to increase body awareness, you know, I think it's really important, and I think healthy exercise does bring about a body awareness, but not necessarily body obsessiveness, and that's again why the goals to lose weight or the goals to look better and exercising, you know, in that arena is problematic, because those kinds of goals tend to make us, you know, decrease body awareness. We don't want to hear our body saying it's tired or it's fatigued. You know, the whole no pain, no gain, that is really not a great strategy, right? If your body is screaming at you, if your body really is in pain, you got to tend to that, right? You need to like be aware of what your body is telling you. And again, we have to accept, okay, this is where I'm at and I'm not as capable of doing what I want to do. Maybe I need to live in that for a minute and accept that that's where I'm at, and then figure out how do I keep myself moving if I have particular fitness goals, but not just forcing myself, ignoring what my body is saying. That's body obsessiveness. I have to get myself there, and I have to get myself there quickly. I've seen this a lot with postpartum women, you know, who just feel a frenzy of, I gotta get this baby weight off, I gotta get going on this. And as a result, you know, function in a way that really isn't healthy and is really imbalanced, and it's body obsessiveness. It's not body care at all. It's not body awareness at all. I would love for folks to be exercising with goals related to how you feel, right? It's a wonderful thing to finish a workout and feel strong and feel your heart, you know, doing better. It's wonderful to set up stamina goals, right? Strength goals. But if the focus is really on what I look like, a workout is not going to make me look any better, right? If I go out today and I engage in a really fabulous, wonderful workout, my body really isn't going to look that much different tonight when I go to bed, right? So you can see that even if I have some body goals and I want to get healthier and I want to manage, maybe I am, you know, pre-diabetic or something like that, and I really do need to be addressing some issues in my body. But if I'm focusing on how I look, if I'm focusing on weight, I'm not going to be super motivated to keep on going, because I'm not going to look that much better after a workout. It's one of the reasons why I think people get really frustrated, and, you know, people kind of, you know, maybe start in January really with gung-ho, and by March they're kind of like, I don't really want to do this anymore. But if you focus on how you feel, absolutely. If I, you know, engaged in a workout and I feel good about my body and I'm aware of what's happening, I'm feeling stronger, I'm feeling more stamina, by the time I go to bed that night, I feel better, right? I feel good about what I just did. It's a fabulous goal, and it's really constructive. It really promotes continuing on with that. But it's okay to pay attention to your body. It really is. You know, just setting up a workout that doesn't include any body awareness, I'm just going to do my workout no matter how I feel. I'm going to just keep on keeping on no matter how I feel, really misses the point. right? Like the point is to feel good about exercise and to develop a really positive relationship with your body where it works, you know, and it works well. I have to have this body for my entirety of life. I would like it to work with me, right? I don't want to be in an antagonistic relationship with my body. Other aspects of keeping exercise healthy, practice other coping strategies, right? Again, there's nothing wrong with working out to manage stress, to relieve tension, to deal with emotions. I mean, obviously you can imagine I sit in my office all day with people, so my preferred form of exercise is I run in the park alone. And I'm always having people say to me, oh, you run, you want to run with me? I'm like, nope. I don't want to run with you because I don't want to hear about your stuff, right? I'm not trying to be mean, but for me, it just doesn't help, right? For me, I have to develop coping strategies that fit in line with what I'm doing, right? So it's great to have exercise be a part of that, but it can't be the only thing, right? I do have friends that I walk with, you know, I don't like to run with them because I don't want anybody making me run faster than I want to run or slower than I want to do it my own way. But I love to walk with my friends because we solve all the world's problems and they're great and it's social and it's wonderful. But it's a much, you know, and I'll tell you, there are days when my stress level might be high and I will opt to go walk with my friends rather than go run by myself because that dynamic is a better coping strategy than maybe just exerting all the energy. But if you do find yourself really relying on exercise primarily for your coping and for your emotional well-being, it really behooves you to develop other things, right? Journaling, talking to friends, even doing activities that maybe are more life-giving, you know, like a walk along the river, not so much this time of year. I grew up in LA, so it's a little tricky for me this time of year to find beautiful things. But the other thing is practice flexibility. You know, be careful about expectations. There are days when it really isn't in your best interest and it isn't really healthy for you to work out. It might be better to actually go to bed or take a nap, right? Or actually like eat a good dinner with your family. Something that I've noticed even in my own life is, like I said, I like to run, and if I have a run scheduled or something, you know, I planned it in my day, and then my day gets crazy, and I don't have as much time as I wanted to. Sometimes I find myself battling, like, is it even worth it? I don't even know if it's worth getting sweaty and having to take a shower, because I'm not gonna have enough time. I'm like, Gwen, come on. Even if I'm getting a shortened amount of time in, it's still valuable, right? And I even have to like challenge myself to be flexible, because sometimes we have these expectations that, you know, a workout isn't a workout if it's not an hour, right? A workout isn't a workout if I don't do any strength training. A workout isn't a workout if I don't really sweat, you know? I have a good friend that like uses the measure of the sweat in her bra. That if her sports bra has like a moon, you know, the half moon, then she's like, okay, that's good, you know? I'm like, okay, that's kind of ridiculous, right? Like sometimes it's freaking cold out there and I don't have as much sweat, right? I'm a tremendous sweater, so like I would win that just like, you know, stepping outside. But we want to be flexible with that, right? We don't want to be so rigid that our exercise has to fit into that particular box. We want to like make exercise fit into what our lifestyle. And there are some weeks that you just have to say, I guess it didn't happen this week, right? You know. But again, if the focus is on how you feel, if you have a week like that, it's not like, oh, it's not working, missed all my goals anyway, I might as well just stop. No. When it becomes healthy again and available and you have the room, you'll get back on it, right? Be active in non-exercise ways. I think one fabulous way to protect against problematic exercise is doing other activities, right? Like really chalking up, like not just, I go to the gym and that's my exercise or that's my fitness level. No, we want to have an active lifestyle, right? I mean, every research indicates that having an active lifestyle is far more productive and healthy in terms of cardiovascular health and well-being and emotional health and all of that than just doing a gym activity or just doing a targeted exercise. So you want to add other things like that in there, right? Like playing sports, right? Engaging on a team, doing things socially, because one of the beautiful things about doing things socially is if you're starting to veer off the edge, if you're starting to get a little compulsive with it, you're gonna have a friend that's like, that's weird, you know? I did for a while run with a friend of mine, and we were training for an event, and she showed up one day with like the whole heart monitor and like the heart rate and stuff, and I could tell something was up. And she was really, really pushing our pace. And I was like, what is going on? Like, we had always been pretty casual runners, you know, we show up, we go, we don't track time, we're not looking at watches and all that. And yeah, definitely there was something going on with her, right? And I noticed it instantly because we were together, right? So if you're always exercising in isolation, if you're always exercising alone, you miss out on some of that information, right? And you miss out on it being fun, right? It's not that it's not good for you, but there is an element that's more motivating if you're with other people. So don't make it just about the exercise goals, make it also about the greater lifestyle. And the last thing, which maybe is obvious, is don't compare. It is the quickest, fastest track to feeling pretty miserable, right? Because we never compare fairly, right? We always compare with somebody that looks like they're doing a better job, or somebody that looks like they have the one thing that we might be frustrated that we don't have. It just is a really detrimental way to not, or it's a really detrimental way to approach all of this. And also, you have to have your own goals, right? You have to have your own fitness expectations, your own goals, because nobody else has the life that you have, and nobody else has exactly the body you have. So it doesn't make any sense at all to set up what you're going to do for you based on what somebody else is doing, you know? And again, stay in your lane, right? Stay in, if this is where I'm at and I'm moving in a direction that pertains to me and that's good for me, I need to stay there, and I need to accept what I'm doing and support and encourage what I'm doing, rather than kind of looking over the fence to see what somebody else is doing and then using their goals and their standards to me. It just doesn't work. So, questions. I want to make sure that's my last slide, yeah. Questions, comments, places where this is hard. Easy? Do you have friends, family members, folks that you're concerned about that are in that very precarious zone where you see them really, you know, struggling with it? Yeah. Go ahead.
If you do recognize this in someone, what's the best way to approach them, the situation?
Yeah, a couple of things. I mean, first of all, I meant what I said, your words matter. One of the very, very best things, and I'm telling you, I spend all day, every day listening to this stuff, and your model is really your best tool, you know? You keeping things moderate, because what you have to understand is someone who's struggling with this doesn't always have the perception or have the ability to see outside their box. So if you're talking about exercise in a moderate way, or you're talking about food in a healthy perspective, you know, that really does make a huge difference, you know, without you even confronting or directly addressing it at all. So that would be the first thing, is I would say, if you notice that you have somebody in your sphere that you're worried about, check your own stuff, right? Come back in and be like, hold yourself accountable, because that's the easiest thing, right? Like, and it's the thing that you can absolutely 100% do, right? Can't always make other people see things, we can't always make other people make changes, but if I can check my own stuff, you know, and change my language, that really does have an impact. Second of all, don't assume that what you see, they see, okay? Folks that are struggling really do find ways to support and validate and affirm what they're doing, even if it's unhealthy, right? So don't assume that, like, oh, you know, they went to Gwen's talk, they know, yeah, no. Like I said, even though I sit with people all day long, even over and over and over again, we're talking about these things, it doesn't always sink in. And it's because there just is a blindness there. There is a compulsivity that forces, you know, I want to keep doing this, it's working for me, and I don't want any evidence that would indicate that I can't do it anymore. So if you see something, say something. you know? If you're concerned, it's absolutely legit to say something. I will say it needs to be in the context of a relationship, you know? I don't think you should be going across the gym to some girl that you've seen working out, you know? I've had more than a few clients that got accosted in the grocery store, you know, by really well-meaning people saying, I've noticed, you know, I'm really thin, you know, that is like not effective and really creepy. So, you know, so one thing would be, you do have to earn the right to be heard, right? Like if you're going to say something to somebody, you have to have a relationship. But if you do have a relationship with somebody, say something, right? And I think the best approach is not to tell them what they're doing wrong. You know, you work out too much. You know what, you're this, you're that, whatever. The best approach is to share what you feel or what you've observed, you know? Hey, you know what? I'm worried about you. Like, I'm kind of concerned. I've seen you change, you know, kind of these patterns more recently, and it worries me. It concerns me. I don't want you to get stuck in this thing, and I'm concerned. Because one of the most beautiful things about sharing how you feel is they can't argue, right? Nobody can tell you, you're not worried, you're not concerned. Well, you can't say that, right? If I'm worried, I'm worried. Like, now, there might be no reason to worry, and they may tell you that. There's no worry. It's okay. It's all fine. Okay, fine, but I am worried, and I am concerned. And also just observe to them what you're seeing. Because often, folks that are in that space, they are not great objective, you know, observers of themselves. So other people's observations do make a difference, right? So if you see something, just say something. I'm concerned about you, I'm worried about you, I've noticed, you know, you seem to be losing a bit more weight than seems healthy. It seems like I've seen a lot of changes in what you're eating lately, or your talk about your body just doesn't match what I'm seeing. You look great to me, and you're just so negative, and that just worries me. You know, I've just observed that. Very rarely is somebody going to say, thank you, you're right. They're usually going to say, no, I'm fine, but let me tell you, I can tell you from the other side of the fence, they do listen, right? Observations, worries, concerns shared by people in their lives really do make a difference, you know? And so I think we do have an obligation, right? If I thought someone that I loved was doing something else that was really detrimental to their health, I would say something, right? Part of the problem is there's an inherent competition, you know, when it comes to fitness and diet and bodies and all of that. And oftentimes people get kind of hung up in, I shouldn't say something, or I don't want to make her feel bad about it, or I really need, I'm not very healthy either, I really need to be working on my stuff, I don't have a right to say, that's all bullshit. Just, if you see something, say something, you know, tell people if you're worried about them. Anything else? Go ahead.
Okay, I feel a little weird by saying this, but if you feel like you're already fit, you go to the gym like probably 3 or 4 times a week or something, and you feel satisfied, you eat well, and for some reason you're not losing the weight. How is that comparing to somebody saying that they don't say that, oh, you go to the gym, we're proud of you, and all of that, and they just don't see the perspective over what you have done for your health and for your lifestyle.
Yeah, exactly. So what happens when other people aren't affirming of the work that you have done? Yeah, I mean, first of all, you know, not everybody was born to be a size 2. And it doesn't matter how much you exercise or what you do with food. Like, unfortunately, you know, body size is hugely genetic, you know. And the other point is that healthy isn't necessarily tied to size, right? There's a whole movement out there called Health at Every Size, and they do research and they publish and they really confront this notion that, you know, certain measures and certain charts, you know, for height, weight, and all of that really aren't really indicators of health, right? They might be indicators of what might be an ideal body size or shape, you know, society-wise, but not necessarily health. And so one of the things we have to be really focused on is, you know, is my exercise and fitness Is it really, do I have good heart health, right? Or what do my vitals look like? I had a patient one time, this is a true story, she was probably, I couldn't even guess at her weight because I don't tend to weigh patients, but somewhere between 300 and 400 pounds. And she had pretty horrific eating issues, and she was binge eating and really, really struggling with some pretty emotionally generated eating patterns. And so she was working on some things, and she was able, I'm going to go long story short, she was able to engage in a pretty consistent exercise, food, self-care routine, right? And I'm telling you, this was a woman whose vitals were pretty scary. Her physician was very concerned. She was having all kinds of, I think she was actually diabetic. Obviously, weight, height, stamina, everything was she was in a rough space. Over the course of several months, she developed this routine where she was walking on a treadmill and she was eating better, her binge eating completely fell away, she was happier, healthier, and she went to her physician and found out that she had lost 5 pounds. And she stopped all of it. Her vitals were fabulous. She literally was no longer diabetic. Her blood sugars were completely in line. Her heart rate was good. Her physician was like, what are you doing? Like, your statistics are amazing. But the fact that she had not lost any weight, well, not any, she had lost 5 pounds. She said, if I keep at this, I'm never gonna, I'm not even ever gonna be in a weight range that I can live a healthy, normal life, right? We don't really know that, right? Because if she had stayed on that, typically weight does get into, a healthy range, right? But we have to give credence and give validity to those internal changes when we're defining health, right? If health is only defined according to body size, we are missing a huge thing. And unfortunately for this woman, what had been a really healthy journey for her stopped because that one dynamic wasn't there. And unfortunately, that's about education, right? Some of that is communicating to people, hey, I feel so much stronger, I feel so much healthier, I'm doing so much better, my sleep is better, my blood sugars are good, I'm feeling really good about what I'm doing. And size is not in my control, right? How much how I eat, how I exercise, how I take care of myself, what I do to care for myself emotionally, those things are in my control. My size, not so much. And so, my message to people is we have to really focus on the things that we can control in order to have good health, because I don't want to be tied to things that are not in my control. And my size really isn't 100% in my control. If I'm doing all the other things and I'm healthier, I need to feel okay about that. And sometimes it takes some work, sometimes it takes some effort to let go of, stereotypes and expectations and body image, and sometimes we really have to work to affirm that this level of health is actually really good for me. But what I typically find is that if that's where you're supposed to be, that's where you're supposed to be, right? And if that's not where you're supposed to be, and you keep on doing the things you can control, weight will shift and change eventually anyway, right? So I really do, I think we have to be a part of educating, the world that size is not always 100% in our control, and we are doing all the right things and we're taking care of ourselves, and those are the things I want to be judged for. Does that answer your question?
A little bit, yeah. I live with my mom, and it's sometimes there's always conflicts between that a little bit.
Yeah.
And I've just been eating really well, and for me, I feel like she has a different perspective than I do.
Right.
And it's always been a little conflict with the mother-daughter thing going on.
Yep. Yeah, and I do believe sometimes you have to plant your feet and communicate, you know what, I really don't want to hear that. It's not helpful, it's not accurate. I'm really proud of myself. I've really been doing a good job of taking care of myself, and I need you to get on board, right? There's a lot of fat, size, weight prejudices out there, and we do have to confront them, right? Healthy bodies, do come in different sizes, and that's just what it is, right? And it's inconvenient, it's uncomfortable, it isn't something we like to talk about a lot, but perpetuating the stereotype or perpetuating the myth that everybody can be, a particular size if they just work out enough or they just, eat a certain way, it's not true. And it doesn't promote well-being, it doesn't promote health. So I would say that, if you're doing the things that you can control and you're doing the things well, you need to stand up for that, right? And really stand firm. And these are good things, and I feel really good about it. So.
Dieting is not good for you, isn't it?
Is what?
Dieting, like special diets, right?
Yeah, I'm not a fan. Mostly just because, one of the other interesting research is that when you link, so if there's a study was done, I want to say in the 70s, and it's been repeated a couple times, where half the cohort just exercised, half the cohort dieted and exercised, and actually the cohort that just exercised lost more weight over a longer period of time and kept on exercising, and again, their vitals improved significantly. The diet and exercise cohort, they might have lost a bit more weight at first, but they didn't keep it up, right? And that is much more prone to the kind of yo-yo weight changes and the yo-yo dieting, which really isn't healthy overall either. So, any problem, a diet in the sense of I'm trying to make good choices and I'm trying to eat moderately and healthfully or whatever, totally great. Diet as a food plan, absolutely healthy. But a diet that's restrictive or that says I can't have, a huge portion of the foods on the planet or, those kinds of things, that can be kind of problematic. So, and again, just because it fuels compulsivity, and we don't exactly know what health is, right? So it's really easy to jump on the diet bandwagon and say, well, I'm trying to eat healthier. But there are a lot of diet plans out there that are just simply not healthy, right? They're grossly deficit in what we need. And we do know, there's a whole symptom package that comes with starvation and with malnutrition, and it involves things like body image distortion, anxiety, compulsive thinking, calculator brain, all the things that perpetuate the whole dieting mentality are actually perpetuated by dieting and deficits in nutrition. So.
Now, one of the questions that I have is, my doctor put me on a limited diet for inflammation, so I can't have dairy, gluten. And so that obviously cuts out most of the things that we would consider enjoyable in life, and it's presented some challenges in the way that I cook and the way I can buy, and I've had to change my cooking, and that's been really hard. It's affected my family, it's affected me. So what kind of advice do you give people who are trying to have this healthy?
Right. Well, part of it is, there's a number of layers in this. One is you can't compare. You got to stay in your own lane. So if your doctor said, hey, there's some things going on with you and you do have to eat a certain way, it's really important to not, okay, I'm doing this because of these very specific medical issues. I'm not doing this to lose weight, or I'm certainly not promoting this as this is good for everybody, right? I also think there's a big difference between restricting certain foods and restricting intake, right? So there's a lot of folks out there that need to eat gluten-free or dairy-free or whatever. But if you're using eating gluten-free or dairy-free to restrict quantity, then that's problematic, right? I went to a conference once, and one of the dietitians was the dietitian for the U.S. men's tennis team. And there were a couple of men on the team that were gluten-free. And she was telling, our group, what these guys eat is unbelievable. They have to eat twice as much, because they are eating gluten-free. So they do have to change their diet, not just eliminating certain foods, but restructuring what they're eating. It's similar to if somebody becomes a vegetarian, right? There's a trap to just exchange any meat for cheese, right? Well, it's a pretty common mistake. And the reality is that if you're going to eat a particular way, you're going to have to be inserting foods to make it of a similar quantity and of similar nutritional value. It can't just be elimination. And I think that's part of the mindset, is that if you're on a restrictive diet where there are certain things, it's easy to be like, I'm so consumed with all the things I can't have. What you really need to do is think about it in terms of, I've got to rebuild this thing. I've got to restructure, how am I going to get these nutrients? How am I going to get enough quantity, so that I'm healthy? And that, to me, yeah, it's complicated, right? Because it smacks in the face of what other people might be doing around you. It's hard to go to restaurants, there's all of that. But that mentality to just eliminate is really not a good one.
Well, I was going to say, one thing I tried to do is to find substitutes instead of saying, I can't have this, I can't have that.
Right.
But you try to self-talk in a positive way, but it's still, the bottom line is it's really hard. And one of the things I went through is I found that, it's gluten-free. I went through this thing where it's like, somehow I thought it was healthier.
Right.
So that you can eat more of it.
Right.
For that, and I'm like, no, that's not right.
Right.
And so.
Yeah, that was the whole, early 80s problem with fat-free, is that all fat-free stuff had just a really high sugar content, to make, because it tasted like crap. So they just inserted more sugar, so, and people were like, oh, it's fat-free, I can have as much as I want. Well, no, because now you're just ingesting 3 times as much sugar as, it's just ridiculous. So yeah, I find that we do have, it's a precarious watch, and we do have to be careful to just not eliminate things or give permission of oh, well, if it's healthier, then I can have it. I have patients that literally binge on salad, and they're eating, and I'm talking a lot of salad, and it's not healthy. I mean, it's causing all kinds of distress in their bodies, but in their minds, well, I can eat as much as I want because it's low calorie and it's vegetables and it's all. Well, no, that's not healthy at all. And even the behavioral dynamic of it is really destructive. So. You have to kind of stay in your lane and figure out okay, for me, here's some things, here's some staples, here's where I get pleasure out of eating again, here's the things that, feel treats to me, and actually learning how to actually create something different, and it's worth doing that, because that restrictive mentality is really destructive, it tends to make you feel deprived and,
What do you recommend as far as gosh, I think we all are emotional eaters probably. So, I mean, what are your recommendations as far as keeping that in check? And then also, I think hearing that food and exercise need to be separate. I don't know, how she recommend keeping those things separate and I guess healthy expectations? I don't know, because I feel like we've been trained that those things go hand in hand. So it's kind of a whole different thought process. I mean, probably obviously healthier, like you're saying, but I don't know, I'm just curious what.
Sure. Remind me of your first question.
Oh, I'm sorry.
No,
the binge
binging,
eating.
yes, the emotional eating.
Yeah.
Sorry. So first of all, develop other coping strategies, right? I don't think just an initial approach to emotional eating is just restrictive, right? I need to cut that out. I need to stop a behavior. But nobody wakes up in the morning and thinks, I want to emotionally eat today, you don't intend to go emotionally eat, right? But what happens is, so changing a behavior that's automatic is really tricky, right? Changing a behavior that's impulsive is really tricky. But if you're noticing wow, I'm doing too much of this, or you're right, everybody does it. I certainly wouldn't call it abnormal or even unhealthy occasionally. But if you're starting to notice I'm doing this too much, or it's more of an issue of I'm not developing healthier or more varied coping strategies. So even just adding some of those, right? As opposed to just trying to stop the 7 o'clock binge eating, maybe at 3 o'clock in the afternoon, I need to journal or go for a walk or talk to somebody or, I don't know, play with my dog. But I'm just saying create spaces where those emotions are getting tended to before you're in a precarious space where I'm alone in the kitchen with food and my emotions are just taken over at that point, right? Second thing is we have to fix overeating with eating. So if you think about this pendulum swing of under-eating over here, restrictive kind of eating, and overeating over here, it's such a trap to want to fix overeating with undereating, right? But the problem is that just creates the pendulum swing, you know, and you go back and forth. So one thing we want to think about is if I've had an overeating experience, I don't want to skip my next meal or restrict or get those things out of the house necessarily. I want to fix overeating with eating. And so you might want to think about like, okay, if I don't like what's happening over here, where do I need to be more intentional with eating? So that might be, you know, I mean, a huge sort of prompt for emotional eating is restrictive eating through the day, right? If I ate breakfast in the morning and I don't eat anything until I get home at 7 o'clock, I'm probably gonna overeat, right? Because I'm starving and I'm hungry and everything sounds good, right? So a simple solution is, you know, oh, I can't go that long, right? I need to be eating more like every 3 hours or so rather than, you know, every 8 to 10 hours, something like that. Same thing with the next day, right? If I have an emotional eating experience one day, the next day I don't get up and be like, okay, I'm not eating breakfast today, or I'm eating breakfast today, right? You want to think about it as I want to respond to that behavior that I don't like with adding something. I'm forever telling patients, add before you subtract, you know? There's such a tendency to want to eliminate the bad things, right? But really, the bad things are trying to fill in the holes of things that we're missing. So if I'm adding things to my life, add more coping, add more emotional self-care, add more healthy eating, add more water, add more whatever, add more friend time, maybe that I'll fill my life with good things, and then the things I'm trying to eliminate will just kind of fade out on their own, right? Okay, you said this balance between how do you keep those two things separate? I mean, I think a big thing is, you know, if you think about it, like we have to eat every 24 hours, right? We have to get pretty much the same caloric intake in every 24 hours. But exercise is not necessarily on a 24-hour basis. We need to be active, but you don't have to work out, and actually I wouldn't recommend working out every single day. So it doesn't even make sense that we link dieting and exercise, or that we link diet in terms of like food intake with exercise, because we're taking something that has to happen on a 24-hour basis and linking it to something that can happen, you know, on a weekly basis, right? But I think just having some consistent routines are helpful so that you don't fall prey to that. For instance, you might have a routine that says, I tend to work out every other day or something like that, or I work out, you know, these days of the week. So then even if I do eat something over here that makes me a little bit uncomfortable, or I stick to my routine, you know, I kind of stay with that. And the same with eating. I think having routines for eating, having some structure is helpful, right? And not changing that just because I was more active or whatever. So those kinds of routines kind of keep us set, you know. And I guess the other thing about that, there are two bookends for healthy food, weight, body, fitness stuff. And what they are, and they're bookends because they're both equally important. One is structure. You know, if you don't have structure with eating or exercise, it's chaotic, right? Like, I just eat whenever, however, whatever. That doesn't sound very, very healthy or planned. And the same with exercise, right? Like, I don't know if I feel like exercising, I do, or that. We don't want it too chaotic. You need to have some kind of a structure. But then also flexibility, right? Because there are some days when the structure doesn't work. There are some days when life crashes in and things are busy or things are going on or my body's just tired or I'm hungry or whatever. So if you're constantly managing that both of those things are present, I think then you're more likely to strike that balance, you know? So if ever, you know, if I ran into you and said, hey, do you have a structure for how you eat? Yeah, I kind of eat these times of days, or I kind of eat these sorts of things. But do you also have some flexibility? Where sometimes, maybe I don't always, you know, I don't very regularly eat this kind of food, but once in a while I do, you know? I used to work with a dietitian who was obsessed with gyros. And she would have gyro day, you know, once a month. Gyro day for her, right? She had a structure where she didn't eat gyros on a regular basis. But once a month, she'd pick a day and that was her Euro day, right? And so for her, it was like the structure of, yeah, this is kind of how I normally eat or whatever, but every once in a while, you know, I want to allow myself to have that thing that I really love or whatever. But that kind of balance, I think, kind of keeps it a little bit more on track. So, okay? So, thanks, you guys. Thanks for coming.